Well, did you know there's a breaking news essentially in the dentistry world? There's a new kind of x-raying. It's called three-dimensional x-raying, and it's essentially designed for less radiation for the patients and also to allow dentists to see things, to detect things they would not have seen otherwise. We've got Dr. David Sarver here with the details. Welcome.
Good morning.
Good to see you.
Tell us, how does this work?
Well, it's called cone beam radiography, or CT, and it's the new generation. Everybody knows what a CT scan is. But a medical grade CT scan is a lot of radiation, and so what we're trying to do is adapt computer and software and technology, to a lower radiation level, which gives us great detail. You can see here that what I'm able to see on the X-ray here is that tooth is behind the other two teeth. And it's actually, if you'll notice that, is that as I take this software and I move down, I can see where, I actually see the pulp of the tooth, and I can see where part of the tooth is dissolved away, which on a two-dimensional X-ray, you know, they're on top of each other, and I wouldn't be able to see it. Whereas being able to rotate it around, I can walk right through the tooth and see exactly where the damage is, how much is occurring, in a case where I would not have even seen it with our conventional X-rays.
About how old was that patient?
That patient was about 10 years old.
Okay.
Now the reason that's important is because, you know, for example, the parents looked into their child's mouth and looked normal to them. Yeah. Okay, and the dentist took their normal screening X-ray, but the dentist was smart enough to look and go, I don't know, I just don't know, and sent the patient for us to look, and we were able to spot the problem.
I want to show viewers a picture. We've got a picture up of right here. This is a patient, right?
That was the kid.
Okay,
yeah.
That's the kid. So from the outside, looks normal. As a mom or dad, you might say, okay, my kid's teeth are coming.
Well, typical thing, mom came in and said, I don't know why we're here. The dentist told us to come. The dad doesn't understand why we're here. And, you know, so.
What was the patient complaint?
There was no complaint.
Oh, okay.
But see, it's like.
It was just time to visit the dentist?
Right, but it's just like if you don't take your blood pressure, you don't know if you've got bad blood pressure, right?
Right.
So you monitor it. So this is part of dentistry in children. That's why you go to the dentist every 3 months or every 6 months, is because the dentist is trained to look for these sort of things.
And we've got another picture we could put up. What is this we're looking at?
Well, that's the conventional two-dimensional X-ray that we use for screening, which, you know, if you look at it, you wouldn't see anything particularly remarkable. But for the dentist who saw it, they went, well, you know, something doesn't look just right. Let's get looked at in 3 dimensions where we can see it better.
I got you. So that it gives less radiation for the patients, it's safer, and it also helps you detect, you said cyst and maybe other things, developmental issues. Yeah,
it expands into all of medicine and dentistry. I get referrals from ENTs and all sorts of folks because you can see infections that, for example, in a two-dimensional X-ray, an infection, you know, we think of things going the direction we expect them to, but sometimes they'll go in different directions. And what might look a little speck like that might be that long and be a huge infection, but you can't see it until you're able to see it in 3 dimensions.
Okay. Well, if you would like to get more from Dr. David Sarver, he's at Sarver Orthodontics. We certainly appreciate your time.
Thank you.
All right.
Thank you as well.